Welcome back, Straight Talkers. Today I'm going to talk about the medication Valproate so that you could be more informed when deciding whether or not to start this medication. By the time this video ends, you're going to know how the medication works, what it's used to treat, commonly used dosing strategies, potential side effects, how long you'll need to be on the medication, and how to stop taking the medication if you decide to come off of it. But first, please make sure to hit that subscribe button so that you can be the first to know when new content comes out. It's important to recognize that each medication typically has a generic name and a brand name, and doctors will often use these names interchangeably. So Valproate is the generic name, and Depakote and Depakote are the brand names. Valproate was first made in 1881 and came into medical use in 1962. It's on the World Health Organization's list of essential medicines, and in 2018, it was the 131st most commonly prescribed medication in the United States, with more than 5 million prescriptions. And it initially first was used to treat seizures, and because of this, it's sometimes called an anticonvulsant or an anti-epileptic. However, in psychiatry, we use it to treat behavioral problems such as aggression, anger, and severe mood swings, and it's often referred to as a mood stabilizer. So how does this medication work? While the exact mechanism of action is somewhat unclear, what we do know is that Valproate increases the concentration of the neurotransmitter GABA in the brain, in addition to blocking sodium channels. In adults, Valproate is FDA approved for the treatment of acute mania and mixed episodes in bipolar disorder, migraine prophylaxis, and seizures. It's FDA approved for the treatment of seizures in kids as well. And it's often used off-label and can treat several other conditions, including bipolar maintenance, bipolar depression, psychosis and schizophrenia, impulse control disorders, violence, and aggression. Valproate comes in tablets, gel capsules, liquid syrup, and sprinkle capsules. Most forms are taken 2 to 4 times per day, but the extended release form is only taken once per day. When patients are on this medication, we will often obtain blood levels, and this helps guide dosing. To see if the medication is at the right dose, blood levels should be drawn first thing in the morning, around 10 to 12 hours after the last dose, and before the morning dose. In acute mania, we aim for a blood level between 50 micrograms per milliliter to 125 micrograms per milliliter. And for most people, this would be around maybe 1,000 to 1,500 milligrams per day. And the max dose is generally either 4,000 milligrams per day or 60 milligrams per kilogram. Regardless, if I'm using this medication in kids, I'll often start at a low dose to help reduce the risk of potential side effects. And my approach is always to start low and go slow, meaning that we start at a low dose and increase the dose gradually and slowly over time with the goal of finding the lowest effective dose. And generally, if someone is taking this medication for acute mania, effects should be seen within 1 week, whereas it might take several weeks to months if being taken for mood stabilization. So it's worth noting that if someone is changing from Depakote, where they're taking multiple doses per day, to Depakote extended release, where they're taking it only once per day, the dose will likely have to be increased. And this is because patients will get about 20% less Valproate with the extended release version. Now let's talk about potential side effects. There are multiple side effects that can occur with this medication, with the top 5 reported in clinical trials including nausea, somnolence, dizziness, vomiting, and accidental injury. Other commonly reported side effects that are more unique to this medication include weight gain, hair loss from the scalp, increased facial or body hair, and acne. More serious but less common side effects could include liver damage, pancreatitis, low platelet levels in the blood, polycystic ovary syndrome, increased ammonia levels, hypothermia, somnolence in the elderly, and suicidal behavior or ideation. Generally, it's recommended that women avoid taking this medication when pregnant unless absolutely required. And this is because Valproate is considered to be one of the most teratogenic mood stabilizers out of all of them. It has around 6 to 20% rate of congenital malformations, and most commonly we see things such as neural tube defects. And these effects are often dose related, with the greatest risk at doses 1,000 milligrams per day or higher. And if it's needed during pregnancy, high dose folic acid supplementation is recommended. It's also important to realize that taking multiple medications at the same time might cause one medication not to work as well, or even lead to an increased likelihood of potential side effects. So you should always talk to your doctor or pharmacist before starting a new medication. And make sure your doctor has an up-to-date list of all the medications you're taking. This includes not only those that are prescribed to you, but also those that you may have purchased over the counter or on the internet. And for Valproate in particular, one medication that we will always want to know if you're taking is lamotrigine, also called Lamictal, as taking both together can increase the risk of a dangerous skin rash. When someone is put on Valproate, it's ultimately unknown exactly how long they'll need to be on it for because it's often dependent on the condition being treated. Someone with bipolar disorder might need to take this medication for years, right? While someone who is taking it for aggressive behaviors might only need to be on it for a few months until various behavioral therapy strategies start to take effect. When deciding to come off of Valproate, please do not stop taking this medication without talking to your doctor first, because they can help work with you to come up with a plan on how to stop the medication so that unwanted symptoms don't occur. My approach is always to gradually reduce the dose rather than abruptly stopping the medication whenever possible, because doing so can help prevent uncomfortable withdrawal symptoms that can occur from trying to stop the medication too quickly. Thanks for watching this video. Now head on over to the next one to find out more ways that you can live your best life.